All right, so earlier we looked at coronavirus into Africa, how it was imported across various countries, and that the discussion tonight on the African perspective. Aldrin Sampier, your host with us tonight.
Yes, certainly. The focus on the coronavirus still continues, and we'll be speaking to Dr. Regina Osse around how the virus has spread on the continent, but also some of the things that people should take into consideration, especially those whose immune systems have already been compromised, people who have been diagnosed, for instance, with HIV, AIDS, TB, and so forth. But very important to the conversation that we're having as well is that now that the World Health Organization has declared it a pandemic, what does this mean? What is it that countries should be doing in terms of the resources that they should be making available? And just listening into that press briefing as well from the WHO around the issue around mitigation as well as containment. What does that mean?
Yeah, and maybe a chance for Africa to still contain. They were saying you have to contain where you can and prevent the spread, especially if we don't have those huge outbreaks like we've seen in Europe.
Sure. Like we're currently seeing what's currently happening in Italy.
Yeah. And
we just heard from the press briefing as well that Iran and Italy, those are the two countries that are really struggling. How do you make sure that countries on the continent don't struggle? Because we have countries here on the continent that have very weak health systems. Also from that press briefing, what we heard is that there are countries that don't have isolation facilities. And with the absence of isolation facilities, what does this mean for the spread of the virus and also the containment of the virus as well? There's a case, for instance, that we heard of in Zimbabwe, where one man who was from Thailand was then sent to a local hospital by his private doctor, but he fled. He left the hospital. He fled off. What does this mean? Yeah. Is there a risk of the virus now spreading on in Zimbabwe? Because we also know that Zimbabwe's health system has totally collapsed. You know what the doctors have been on strike there, including the nurses, because of issues around payment. And the entire system has collapsed. What does this mean for a neighboring country like ours here in South Africa?
A very scary situation. Thank you very much. And you can join Aldrin Sampier with the African perspective at 9 o'clock tonight.